Hi, my name is Jim Marcin, and today I'm going to be talking to you about Pediatric Telemedicine in the Department of Pediatrics and the Children's Hospital at UC Davis. The Pediatric Telemedicine program here at UC Davis is what we call kind of the triple threat. We here at UC Davis really involve a lot of time and effort and energy in the teaching and education of students as well as providers in the community. We also do research on quality and safety of care, and we are consistent with our mission. We are committed to providing the best care possible to underserved communities. And what we're able to do is use pediatric telemedicine to accomplish all three of these missions simultaneously. Regarding our educational mission, we have quite a large team here that works in pediatric telemedicine. It consists of many undergraduate students, medical students, pediatric residents, and we also collaborate with other organizations in the School of Medicine as well as other schools, including the graduate group in epidemiology, the graduate group in health informatics, the School of Public Health, as well as international scholars that come here specifically to work with the pediatric telemedicine program. Regarding our research mission, which is consistent with our clinical mission, UC Davis prides itself on using telehealth and telemedicine technologies to serve rural and community emergency departments. One of these models of care uses telemedicine to provide rural and community emergency departments immediate access to pediatric subspecialists. We've done a lot of research in this area and demonstrated that this model of care increases parent satisfaction, remote provider satisfaction, quality of care, increases safety of care, while simultaneously reducing overall costs. And all of these findings have had policy implications both on a local level here in Sacramento and in the state, but also on a national level. Of note, we do have the largest pediatric tele-emergency program in the country. We also use telemedicine to serve community hospitals and ICUs, where they're caring for young children or adolescents that may not require the expertise that we have here in a tertiary center, but we help them take care of these children by looking over their shoulders and making sure that the care that they're providing is the same care that they would be providing in our hospital if they were to be admitted here. We also use telemedicine to reach out to rural and community labor and delivery units, so when newborn babies are born in communities that may not have a neonatal ICU or a pediatric team readily available to be at the side of a newborn baby that might have unexpected problems, we can be there virtually with telemedicine to provide that oversight and care. We've used telemedicine to assist in the care for children that have been sexually abused or physically abused, and we also have implemented programs of video conferencing for children hospitalized in the emergency department so that they're able to reach their community and friends using video conferencing. So these are just a few examples of the many ways in which we use telemedicine to serve the needs of the children admitted to our hospital. And to demonstrate what leaders we are here at UC Davis in telemedicine, if you were to Google pediatric telemedicine, at least west of the Mississippi, the number one finding that you'll find is UC Davis Pediatric Telemedicine Program. In the academic literature, if you do a PubMed search, you'll find that a majority of the publications, if you sort by relevance, are produced from this Children's Hospital and Department of Pediatrics. We take a lot of pride of that. I'm going to talk about two specific studies as examples that we have underway right now. One is with a master's student, Navjot Dulet, who is a health informatics master's student. He's looking at our database of more than 35,000 telemedicine consultations that we've done on an outpatient basis to more than 21,000 patients. What he's looked at is the amount of travel saved in terms of miles so that the patients are able to get the care in their local community with telemedicine so they don't have to drive to UC Davis or another tertiary center this way. He's demonstrated that to date, UC Davis telemedicine has saved more than 12 million miles of travel. He's looked at the time that it would require to travel this distance to come to our clinic versus their own clinic and demonstrated almost 20 years of travel time saved by using telemedicine by the services provided by UC Davis Telemedicine. And then the travel costs associated with that, nearly a saving of $6.8 million that patients and family members have saved by not having to travel to the big cities like Sacramento to be able to obtain of specialists. The final thing that Navjot looked at was the emission savings and demonstrated 4 4.4 thousand metric tons of carbon dioxide emissions. So not only is telemedicine convenient, cost savings and time savings for patients and families, but it's also green. A second study or point of research that I'd like to discuss currently under review is looking at what's called the Community Needs Index score. This score is reflective of how much medical care a community needs based on census data. What's shown here on this graph on the upper line is ambulatory sensitive conditions, and it demonstrates that as the CNI score increases, the number of admissions increases. That is, these communities have higher health care needs in the ambulatory care setting. Non-ambulatory sensitive conditions are flat across this curve, demonstrating validity of this. So the bottom line is the higher the number, the higher the community need is for healthcare services. And we're really proud to say here that the master's student working on this, Taylor Kaufman, again in the health informatics program, demonstrated that the mean community need index score in California is 2.99, but where we are providing services to at UC Davis telemedicine clinics is a mean CNI score of 3.32, demonstrating the fact that we here at UC Davis are really reaching out to provide subspecialty services to communities that really need us the most. I want to thank you very much for your time. Again, this is an overview of the Pediatric Telemedicine program here, and I'm Jim Marcin, and I'd love to hear back from you if you have any questions or comments.